A very difficult topic for many of my clients to talk to their partner about is when they feel their partner has let go. Their partner has no longer taken the initiative to stay clean, to brush their teeth, to work out. They wear slovenly clothes. They don't, whatever they're going through, they feel like they settled. They feel like they're comfortable in their relationship, that they married their partner, they're in it for good or bad, and this is who they are. And people can get very defensive when they've let themselves go, when the other partner tries to broach the topic. And oftentimes the other partner gets so angry, so nagging, that it just goes in one ear and out the other. And the partner who's hearing all this learns very quickly to tune them out, that they don't want to take the initiative it takes. If your partner has gotten so lazy or given up so much that they no longer brush their teeth or comb their hair or take showers or smell good for you or go for walks, take care of their body, if they're eating terribly, the first thing I want to caution you about is this could be a sign of depression. People who are depressed correlate with those people who do not take care of themselves. They stop taking care of themselves. So the very first thing I would do if I was married to someone who had totally let go, who had totally just, not taken care of themselves at all, is I would go to the doctor with them. I would make an appointment if they were too lazy or unwilling to do it, and I would go with them and I would tell them what is happening. Sometimes medical diseases will present this way, things like diabetes, things like cancers, things like blood loss. Whatever it is, people will get tired, they'll give into it, they'll get depressed, and they'll stay in a rut. But if it's more than that, maybe your partner is resentful and this is a passive-aggressive approach. Or maybe your partner feels like you don't give them time and attention, and so they've let themselves go because in the beginning, the whole reason they were taking care of themselves was to be attractive to you. I'm not saying that is a good idea. I think self-care should be intrinsic. It should be something you are motivated to do because you're a responsible adult. But for many people, that is not true. They only fixed up through the dating, through the marriage, and then once they're married, they just totally let go because they feel ignored or they feel stressed or whatever, and maybe you're not attentive to it and they feel like you're dismissing them, and so they will just live like that. The other thing I would say, and this is more uncomfortable, is I would say, listen, we have got to talk. I can't accept this. You're not taking responsibility for yourself. I need to see a change. And then as the partner who is most upset by this, go ahead and say, I am willing to start a program with you. Many times having your attention in that way is enough to jumpstart your partner. Secondly, if your partner is resistant to that, you can at that time set an ultimatum. And you can say, listen, you don't want to take care of this, you don't want to face it, you don't want responsibility. And so I'm going to tell you, I am not attracted to it. I cannot see myself continuing like this. Something has to change, because when you get married, it's an equal effort type thing. And if your partner is not putting any effort into how they look, how they maintain themselves, what I'm going to say to you is attraction is deeper than just what it looks like on the outside. You're also attracted to their self-respect, to their self-motivation, to their ability to self-make goals and actually try to achieve those goals. So if they aren't taking care of themselves, if they're purposely resisting, then there's something else going on in the marriage. And outside of counseling, I cannot think of anything you could do at this point. Refusing to be their partner or saying, I want out of this marriage because my partner won't take care of themselves is a little short-sighted. And I'm not sure I would recommend that, because I also think it's kind of shirking your responsibility for the marriage. So the way I would do it, I would give them 3 approaches. Number 1, we go to the doctor together. The doctor runs all kinds of tests, and the treatment they suggest is what you start together. You're on team togetherness. Secondly, I would offer to be kind of their workout mate. I would go to the gym with them. I would go walking with them. I would meet them where they are at that level. I would also start changing our diet. No matter how good a shape you're in, you can join them. They can join you, but you'll have to start smaller steps, because if you're really in good shape and you're eating a really healthy diet and they're eating junk food, you've got to do this in small increments. And thirdly, I would go to counseling. I would find a good marriage therapist, and I would suggest the 2 of you go to marriage therapy, because I bet if they've resisted all of these other methods, then there's a high likelihood some past resentment, some hurt feelings, some overlooked insensitivities on somebody's part and miscommunication have been completely swept under a rug or ignored. And at that point, as part of this relationship and co-creating something you both love being part of, I think it's essential that you work on these 3 areas. I would not recommend you let your marriage go with this one thing. I would not start looking at other people or flirting with other people. I think both of those would have more of a tendency to break the marriage down further, so it wouldn't be salvageable. And having a partner who has given up on themselves, who has let themselves go, is not a reason for divorce, because there's a lot of potential. I've seen it in my office and I know it's possible. If this video is helpful to you, please subscribe to my channel so I can get more insight from you. And if you're already a subscriber, thank you guys so much.